Hey guys, I'm Junior and welcome back to my YouTube channel. If today is the first time knowing me or watching my video in my channel, then I'm a first year med student at the College of Medicine and Allied Health Science, Sierra Leone. I know it has been a long time, like I've not been posting videos on my channel and stuff like that, but that's based on certain circumstances or situations. But yeah, guys, like I'm back and I'm going to be posting videos back to back. Okay, so guys, like first year medicine is somehow different as opposed to other stages in the department of pre-medicine, like pre-med 1, pre-med 2. You understand? And maybe even other departments like department of nursing, med lab, and all that. They are quite different. So now, if you watch my previous videos of P1 and P2, so you are mostly going to be doing basic medical science subjects like the mathematics, biology, physics, chemistry, and English. Okay, so those are the subjects you're going to be doing. But now, for first medicine, you are mostly going to be doing four main modules of subject per se: anatomy, physiology, biochemistry, and community medicine. Okay, so these are like the basic of medicine. So if you are going to be enrolled at clinical year, like first year, part one, part two, and subsequently becoming a doctor, then you need to be well grounded at this basic medical science subject, like the anatomy, as I've listed, physiology, biochemistry, and community medicine. So, guys, without wasting much time, let's get to the video now. Okay, guys, so welcome back. So basically, we are going to start with anatomy. Okay, so from anatomy, physiology, biochemistry, and maybe community medicine. So anatomy basically is like a branch of medicine that like deals with the study of structures that make up a region or a system. Okay, because more or less you have two approach in studying anatomy. You have the regional approach, then you have the systemic approach. So basically, the regional approach is an approach wherein in which you are studying anatomy based on region, as name implies. So you have different regions that make up the body. You have the upper limb, the lower limb, you have the thorax, the abdomen, you have the head, the neck, the pelvis, and the perineum. Okay, so like in studying anatomy based on region, you are going to study all of the structures that makes up the region. Okay, so the upper limb, for example, you have the arm, you have the forearm, you have the hand. So all of the structures in the upper limb, like the muscles, the osteology of the upper limb, the neurovascular structures, etc., etc. So that's one approach to studying anatomy. You also have the systemic anatomy itself, or the systemic approach. So for the systemic approach, it's like studying anatomy based on systems. So for example, you have the respiratory system, cardiovascular. That's what other departments are doing, like department of nursing, pharmacy. So they study anatomy based on systems. So like they study the structures that makes up the system. So for example, you have the cardiovascular system. So they are going to study the anatomy of the CVS. Like they are going to study the heart, the vessels, and all of those stuff. So that's what other departments do. But if you are a medical student, then you are going to study anatomy based on region. Okay. So guys, also in relation to anatomy, you need to know your anatomical position, anatomical planes, and anatomical terms. Okay, it is very very important because if you are going to be studying subsequent concepts like the upper limb, the lower limb, thoracic anatomy, abdominal, the head, the neck, etc. Guys, like these concepts are very very important because you have to apply them. Okay, you hear somebody saying anterior, posterior, and stuff like that. So basically, the anatomical position is like a standard reference position. So if you are trying to like locate one structure in relation to another, so let's say for example, you are trying to locate um the hand in relation to the forearm, then you need to stand in the correct anatomical position. Now the correct anatomical position is a type of position wherein a person is standing upright, then the feet, both of the feet are towards each other, then the toes are pointing forwards in the forward direction. But guys, don't worry, I'm going to like show you the picture of it after the explanation. Okay, so I understand guys at level of second year study and medicine, they must have understood this concept. But for you, the pre-medical one student P2, maybe some must have understood the concept, but it's somehow necessary for me to like say it again. Okay, so the feet must be together, then the toes of the feet are pointing in the forward direction. Then as I said initially, I need to stand upright. You stand upright in that straight position, then the hand on each side like this, then the palms, this palmar surface of the hand must point in the forward direction, then the head must point also in the forward direction, then the eyes must open like this, and you stand in that upright and correct position. So after knowing this anatomical position, then now you can locate one structure to another, how this structure is anterior to this. In knowing your anatomical position, then for you to also know the anatomical planes and the terms is also very important. So for the anatomical planes, they have about 3 to 4, something like that. They have the coronal plane anyways. So, but basically, a plane is like more or less like an imaginary line. Okay, so it's like an imaginary line that dissects the body producing different parts. So for example, we have what we call the coronal plane. So the coronal plane is like an imaginary line that splits the whole of the body into anterior and posterior, or more or less ventral or dorsal. So anterior in anatomy means in front of, so in front, posterior, back. Okay, so the coronal plane is like an imaginary line that splits the body. So it's like a vertical imaginary line splitting the body into anterior and posterior. They also have the mid sagittal or the sagittal plane. Now the sagittal plane is the vertical line. It's a vertical line like this way, perpendicular, meaning it forms right angle or 90 degree with that of the coronal plane. It's a vertical line separating the whole of the body into two equal halves. That's the right and the left half. So that's the mid sagittal. They also have the parasagittal. Now in anatomy, para means very close. So if you said parasagittal, very close to the sagittal plane. So the parasagittal is like, it's also a vertical line, but dividing the body into two unequal halves. Okay, so maybe now this is the midpoint. Okay, so if you have a line separating the body like this way into half right and half left, but they are not equal, then that's the parasagittal plane. They have the cross section. That's more or less, I think of it as like one of the most used anatomical planes, the cross section of the transverse plane. So the transverse plane more or less like a horizontal, line like this. So let's say for example you have the forearm. Okay, so if you take a knife and cut the forearm like this in this horizontal direction, okay, that's the transverse plane or the cross section. So these are like more or less like the basic anatomical planes. Now you have the anatomical terms. So there are terms that are also very, very important for you to like locate one structure to another after you stand in the correct anatomical position. So now for the anatomical terms, they come in pairs. So for example, you have anterior, posterior. Like I said initially, anterior is in front of, posterior at the back of. So for example, if you've studied anatomy somehow, then you can say for example the ribs is somehow anterior to the heart and the lungs. So meaning it is in front of the heart and the lungs, etc., etc. Then you can say vice versa, the heart and the lungs, or let me say the lung is somehow posterior to the ribs. Okay, so that's one pair of anatomical terms. They also have medial, lateral. So medial towards the midpoint, lateral away from the midpoint. They have superior towards the head. Okay, so for example, you can say the head is superior to the neck. Behind the neck is inferior to the head. So these are like the basic anatomical terms. They also have proximal, distal, etc., etc. But this is not like a tutorial, okay, per se. So you just need to know these basic anatomical terms. They are very, very helpful for subsequent concepts. Okay, so guys, after knowing all these anatomical position, the planes, the terms, now for anatomy and social medicine, you are mostly going to be doing upper limb, lower limb, thoracic anatomy, and maybe, as I said initially, a fraction of abdominal anatomy, like maybe 1/4 or 1/5 of the abdomen, and they are not going to be assessing you on that. So the three main regions you need to know for fascial medicine for anatomy is upper limb, lower limb, and thoracic anatomy. Now, before going further, these things are very, very important for you to know the osteology. That's the bony aspect, okay, of the upper limb, the lower limb, like the bones that make up the upper limb, the bones that make up the lower limb, and some of the bones that make up the thorax, okay, protecting the heart, the lungs, and other structures like your thymus gland and stuff like that. Okay, they're very, very important for you to know the osteological components. Then you know the joints of the upper limb, like the shoulder joint, you have the elbow, the wrist, okay, and the lower limb, that's the same, the hip joint, etc., etc. So they are very, very important for you to know. So in relation to the upper limb, which is one regional aspect in anatomy, so the surface concept you need to know is the osteological component, the bones that makes up, for example, the upper limb. Okay, forget about you're going to learn them subsequently in subsequent times, like the musculature of the upper limb in the vascular structure. But the osteological components are very, very important for you to first know them before studying the muscles around the upper limb. So for example, your arm, which is somehow proximal to the forearm, you have the only bone in the arm, which is the humerus. So for the humerus, you need to know the features, the site determination, how you can know whether this is the left or the right humerus, the clinical correlate, because you have nerves around the humerus that if there is any fracture, okay, then there will be rupturing of those nerves, which can lead to some medical complications. So you need to understand all of those stuff. Then for the forearm, you have the two only bones in there, that's the ulnar and the radius. So for the radius is most at the lateral aspect and the ulnar at the medial aspect. Then you have the wrist, which is formed as a result of your carpal bones, the scaphoid, about 7 scaphoid, the lunate, tracheatum, the pisiform, the trapezium, trapezoid, capitis, and the armate. So they about 8 of them anyway, sorry. So they make up this wrist. Okay, they have the hand. So you need to know the osteology of the hand, like the metacarpals and the phalanges that makes up the hand. So it is very, very important for you to know the osteological components. So now for the lower limb, on the opposite side, it is somehow the opposite of the upper limb. Okay, so that's the same. So what you need to know, or what you have known for the upper limb, so that's the same application. For the lower limb, the first you need to know the osteological components of the lower limb, the bones that make up the lower limb. Okay, for example, you have the thigh, which is one region that makes up the lower limb. So the only bone there is the femur. Then you have the leg. So the leg is mostly made up of the tibia and the fibula. Then you need to know the ankle joint, which is formed as a result of your combination of the leg bones, that's the tibia and the fibula, plus your tarsal bones, mostly your talus. Okay, and you need to know the bones that make up the ankle joint. Okay, that's the tarsal bones, about 7 of them: the talus, the calcaneus, the navicular bones, the 3 cuneiform bones, that's the medial, intermediate, and the lateral, plus the cuboid. Then the bones that makes up the foot. Okay, so the bones that make up the foot, they are just like the opposite of the bones that makes up the hand. They are the metatarsals and the phalanges. Okay, so you need to know. So before studying the muscles of the upper and the lower limb and the neurovascular structure, you need to first know the osteological components. So now, in relation to the upper and the lower limb, now for the upper limb, you need to understand about the pectoral girdle. Okay, so it is also another region, but it is part of the upper limb. So it is mostly made up of your clavicle and the scapula. So okay, both of these bones connect themselves to each other in such a way they connect the whole of the upper limb to the upper trunk. The pectoral girdle connects this upper limb to the upper trunk, that's the thorax. Then you have the pelvic girdle that connects the lower limb to the abdomen. Okay, so guys, after knowing the osteological components of the upper and the lower limb, okay, you need to understand joints. So that's from high school, most of you understand what joint is, okay? But yeah, so you are going to be doing it somehow more, but that's just surface concept, okay? So you need to know what joint is, like how they are being formed as a result of two or more bones. For example, you have the bone at the level of the arm, and the forearm that forms the elbow joint. So you need to know the joints and the classification of joints, okay? Now, the basic thing you need to know is you have the structural and the functional classification. Now, for the structural classification of joint, it's based on the structure of the joint, okay? So joint is more or less like a region, okay, or let me more or less like a space or a region between two more bones. So within that joint, if the structure is a fibrous connective tissue, then that's a fibrous joint. That's why based on the structural classification, you have three types. They have the fibrous joints, meaning within the joints or between the bones, they are more or less like fibrous connective tissue, more or less type 1 collagen. Okay. Then you also have the cartilaginous, meaning between the bones, they are more or less cartilages. Okay. So for example, you have your joint between so let's say for example you have this long bone, which is the humerus. So you have the joint between the diaphysis, that's the long part of the bone, the shaft, then the epiphysis. So that joint in between there, which is more or less like your epiphyseal plate, so that joint is a cartilaginous joint because the structure is a cartilage in between the bones. They also have the synovial joint, meaning between the bones, it's more or less made up of fluid. So you have fluid between the bones that acts as lubricant. So more or less reduce friction between the bones. So more or less reduce friction between the bones and stuff like that. So that's one classification, the structural classification. Then you have the functional. So in relation to the functional classification of joints, that's just based on the function of the joint itself, as the name implies. So you have three classifications. So you have those that are immovable, which are also known as synatosis. So that's the anatomical term. Then you have those that are slightly movable, which are known as the amphiarthrosis. Then you have diarthrosis. Okay, that's the freely movable joints, which are more or less like your synovial joints. That's the functional classification of joints. Then you need to know the clinical correlates of joints. For example, you have your osteoarthritis and all of those stuff. The thing about anatomy is, if you are studying anything, then you need to relate it clinically. Okay, so if you are studying everything about the upper limb, you need to know the clinical correlates of the upper limb. So in relation to joints, there is an important law in joints, which is also known as the 18th law. Okay, this is very, very important for you to understand. Now, for the 18th law, is trying to say that you have certain vessels, that's your arteries and the veins, that passes through the joint. So for example, you have the elbow joint. And for the elbow joint, you have the brachial artery that passes through the elbow joint, which is a continuation of the axillary artery. So now the brachial artery, you have some superficial veins like your cephalic vein, the basilic, and the mid-artificial vein that also pass through this elbow joint. So these arteries and veins plus the nerves that innervate. So in anatomy, innervation means you are supplying nerve impulse to a muscle in order for it to contract. Okay, so the nerves that innervate the muscles which act on the joint. So for example, this elbow joint, you have muscles like the tricep brachii, the bicep brachii that act on this joint. So the nerves that innervate these muscles plus the arteries and veins that passes through the joint. So all of these neurovascular structures supply the joint as well as the skin overlying the skin on top of the joint. So that's all about the 18th law. So if you have any artery, any vein that passes through the joint, then also the nerve that innervates the muscle that acts on the joint. So all of those structures supply that joint. So that's all about the 18th law. So you need to know about joints. Very, very important. So now, guys, basically anatomy is very broad, okay? So don't mind me. Now, for the upper limb, before talking about the shoulder joints and all of those stuff around the upper limb, like the muscles, the nerves, and your vessels, as the arteries and the veins. Now you need to know about the pectoral region. Now the pectoral region, there is somewhat like a controversy between the pectoral region and the chest, more or less your thorax. Okay, so the pectoral region basically is somehow similar, but it's like a region consisting of structures like your muscles. For example, you have the pectoralis major, the minor, the subclavius muscle, etc. So like it is a region that consists of these muscles which connect your upper limb towards the trunk, that's the upper trunk, okay, or the chest to the pectoral girdle. So that's why it's known as the pectoral region, because it connects the upper limb to the upper trunk through this pectoral girdle. That's the clavicle as well as the scapula. Okay, so that's the pectoral region. So you need to understand the superficial anatomy, the surface anatomy of the pectoral region, the skin, superficial fascia. And you need to understand the muscles that make sure the pectoral region, like you think of the pectoralis major as I've just enlightened you, their origin. Now in anatomy, though for me I just think it's somehow not necessary, maybe in subsequent time, because there are things that you are going to forget. Okay, the origin, insertion, innervation, and the action of this muscle. Like definitely, okay, even if you ask some doctors at this point in time, most of them they have forgot this origin and insertion of this muscle. But it is very, very important as first year medicine for you to know the origin. So for the pectoral region, you have the pectoralis major muscle. So you need to know its origin, its insertion, the nerve that innervates it, and its action that it performs. Okay. Then you have the pectoralis minor, the subclavius. Then you have the serratus anterior muscle. So these are all muscles that make up the pectoral region. Then you need to understand them. Now, from the pectoral region, you have the most important structure in the pectoral region. That's the breast. You also need to understand the breast. The breast, we all know, is of clinical correlate because you have some breast cancers and all of those stuff. So if you understand the anatomy of the breast, then you are going to apply yourself clinically. It may be in subsequent time you want to be a surgeon, okay, like a mastectomist and stuff like that. So I believe you can, understand much about those surgical procedures, and you need to understand the breast, like the skin of the breast, the parenchyma of the breast, you understand, and the connective tissue like the stroma of the breast. So in anatomy or in medicine, parenchyma is like the functional unit. Okay, so it's like the functional unit of maybe a tissue or an organ. For example, you have the kidney. So the functional unit of the kidney is the nephron. So that's the parenchyma of the kidney. Then, for example, you also have your spleen, okay, which is very close to the stomach, which is an immune organ. So the spleen, you also have the red pulp and the white pulp of the spleen. So they perform the function of the spleen. So they are known as the parenchyma. That's the same as the breast. So the parenchyma of the breast is the mammary gland because it is the gland that produces and ejects milk in order for the baby to survive. You need to know the lymphatic drainage of the breast. It is very, very important. Okay, so for the lymphatic drainage of the breast, you need to know the lymph nodes that your lymph around the breast drains itself into. Okay, so for example, you have the axillary group of lymph nodes around the axilla, that's your armpit. You have the parasternal, meaning it is somehow very close to the sternum. So all of these group of lymph nodes, you need to know them. Then because most of these lymph around the breast drains themselves into these lymph nodes in order for them to move back into circulation. That's mostly your venous circulation. Okay, so that it can move to the heart, then from the heart to the systemic circulation to supply your tissues and cells. So you need to know the lymphatic. It is very, very important, the lymphatic drainage of the breast and also the clinical correlate of the breast. So guys, from the pectoral region, you really need to understand something about the axilla. If you are a first year medical student, then you don't understand anything about the upper limb, then this is like a must know. Okay, the axilla is very, very important. Now the axilla is like more or less your armpit. It's a landmark, and most of these landmarks in anatomy are clinical correlate. Okay, so that's why they are really stressing on them. Then you really need to know them because they are clinical correlate. Now the axilla, as I say, is the armpit, and it's like a pyramidal space, okay, between your upper arm and the root of the neck. Okay, now for this landmark, you need to know the contents of the landmark. You need to know the boundaries. Okay, maybe you have some that have walls, for example the axilla. So for the axilla, you need to know the apex of the axilla, you need to know the base, you need to know the walls, okay, the medial, the lateral, the anterior and the posterior wall. So you need to know all of them. Then the content, Now the contents, they are very, very important for you to know. Okay, the contents of the axilla. For example, you have the axillary artery. Now the axillary artery is like the artery that supplies the whole of the upper limb, because now in anatomy most of the arteries, they are like a continuation of another artery. Okay, so as I said initially, based on the arm, the brachial artery is like a continuation of the axillary artery, and that axillary artery is more or less like a content of the axilla, and hence the name axillary artery, because it is within the axilla. Okay, so you have the axillary artery, axillary veins, you have the brachial plexus. Guys, that's very, very important. Okay, the brachial plexus, it is also another most known. Okay, and the brachial plexus is also, a content of the axilla which supplies all of the upper limb. So it's like a collection of nerves. So that's what plexus means, collection of nerves that supply the upper limb. But anyway, it's not like a tutorial part here. Okay, so you are going to know more about the brachial plexus if you do some research, but you need to know it. Okay, because it's a content of the axilla. Then also you have what we call the axillary field of Spence, which is a structure around the breast that extends towards the lateral aspect and moves towards the axilla. So it's also another content. So you need to know the content also of the axilla. So guys, from the axilla, you need to know something about the shoulder joint. So like I said initially, you need to know almost everything about your joints at the level of the upper and the lower limb. Okay, they are very, very important. So the shoulder joint is very, very important. That's the joint between your scapula, mostly the glenoid cavity of the scapula, and that's of the head of the humerus. It's very, very important for you to know. Okay, now from the shoulder joint, it's just like surface concepts. Okay, so from the shoulder joint, you need to know something about the arm. Now for the arm, from the start of the video, I've enlightened you on the osteological components of the upper limb. Okay, so you need to know about the osteology of the arm. That is the only bone present in the arm, which is the humerus. So you need to know everything about the humerus. So now from the osteological components, you need to know the musculature. That's the muscles around the arm, like the bicep brachii, its origin, insertion, innervation, the action. Then the brachialis, which is the prime flexor of the forearm at the elbow joint, the coracobrachialis muscle, the tricep brachii. Okay, you need to know all of these muscles, their origin, insertion, innervation, the action. Then from the musculature, you need to know something about the neurovascular structures. The vasculature is more or less like the arteries and the veins. Now, the arteries around the arm is more or less like your brachial artery. Now, what you need to know in anatomy is most of these arteries extending from, let's say for example, the upper limb, the arteries extending from this axilla onto the hand, it's like a single artery, but the name differs based on the position. Okay, so for example, we have the subclavian artery, which is like a branch of the brachiocephalic trunk of the arch of the aorta. Okay, now this subclavian, once it is at the level of the axilla, it is no longer the subclavian, it is the axillary artery, and continuation of the axillary artery forms the brachial artery. So it is so called the brachial because it is at the level of the arm. Okay, so brachial means arm, so that's why it's known as the brachial artery. So that's like the artery present around the arm. So you need to know its branches, okay, and the structures that it supply, etc., etc. So from the brachial artery, you need to know the superficial veins like the cephalic vein, your basilic, the median cubital vein, etc., etc. They are very, very important. And then the nerves that innervate the muscles which perform some action around the joint. Okay, so for example, you have the radial nerve at the posterior compartment of the arm. Okay, from this posterior medial to the posterior lateral aspect. So most are the posterior aspect which innervates the tricep brachii and all of the muscles at this posterior compartment of the forearm. So they are very, very important for you to know the radial nerve, the axillary nerve, because most of these nerves have clinical correlates. Now, assuming if there is any fracture around the arm or the humerus, like fracture of the mid shaft wherein the radial nerve is located, okay, and there will be rupture, destruction of the radial nerve. So as a result, that can lead us sometimes to wrist drop, as I've said initially. So it's very, very important in the axillary nerve around the surgical. So now, from the arm, you need to know something about the forearm. But before knowing something about the forearm, you need to know these major landmarks. They are very, very important. The axilla. Now, the major landmarks, as I've said, they are like very important spaces or region in anatomy that have clinical correlates. So you have the axilla, as I have enlightened you on. You have the cubital fossa. You have the carpal tunnel. You have the anatomical snuff box. They are very, very important. Okay. Now, before knowing something about the forearm, you need to understand something about the cubital fossa. So now, after knowing something about the arm, then you need to understand something about the forearm. Okay. But now, before understanding something about the forearm, then you need to know this major landmark, as I've enlightened you initially, in relation to the axilla. So you have another landmark known as the cubital fossa. So it's like a triangular depression, as you can see at the anterior aspect of the elbow joint. So it is more or less triangular, and for each landmark, most have boundaries, the roof, the floor, and the content. So you need to know the boundaries of more or less your cubital fossa in relation to the muscles, like your brachioradialis muscle, the pronator teres. They have your imaginary line from your two epicondyles of the humerus, which more or less form this triangular depression. Then you need to know the roof, the floor, and the content, like the radial nerve, the brachial artery, etc., etc., even the medial nerve. So from the cubital fossa, you need to understand the forearm. So that's the same thing, the muscles around the forearm, the arteries and the veins, as well as the nerves. Okay, so that's the same as the muscles at the anterior compartment known as the flexor muscles, which flexes the arm at the wrist joint, and also at the posterior compartment, the extensor muscles that extend the arm at the wrist joint. Okay, and also the nerves that innervate this muscle. So for example, at this posterior compartment muscles of the forearm, they are all innervated by the radial nerve. So if there is any destruction of the radial nerve, maybe as a result of fracture, or maybe as a result of a person falling onto an outstretched arm like this, then something happens to the radial nerve, then there will be paralysis of muscles at this posterior compartment. So you need to understand the radial nerve and also the ulnar nerve that innervates some fraction of the muscles at this anterior compartment, like the flexor carpi ulnaris and a fraction of the flexor digitorum profundus, and also the medial nerve, okay, which innervates all of the muscles of the anterior compartment of the forearm except the muscle that I've just enlightened you on, the flexor carpi ulnaris and the flexor digitorum profundus. So they are very, very important. From there, you need to know something about the wrist and the carpal bones that forms the wrist, and also your carpal tunnel. Guys, like, it's very, very important. The carpal tunnel is very, very important for you to understand. It is also another landmark, okay, for you to understand. So you need to know the content of the carpal tunnel in relation to the medial nerve and the tendons of the muscle that passes through the carpal tunnel. The roof, that's the flexor retinaculum, and the floor, etc., etc. So they are very, very important, and the clinical correlates in relation to your carpal tunnel syndrome. So if there is any compression of the nerve, mostly the medial nerve, then meaning the structures that this medial nerve supplies, mostly your muscles around the hand, the skin, etc., there will be problem with the sensation. So maybe if somebody touch you at that point in time or at that aspect, you will not feel anything because the medial nerve is not functioning. So it's very, very important for you to understand. And also your anatomical snuff box, okay, at this posterolateral aspect. So it's also very, very important for you to know. It's also another landmark. So you need to know the content of the anatomical snuff box, the boundaries, the contents, the roof, and the floor. So they are very, very important. From there, you need to know the osteology of the hand, okay, that's the metacarpal and the phalanges, as well as the muscles, the arteries, the veins, and the nerves around the hand. So like, more or less, guys, this is all about the upper limb. Thank you guys for watching. I really appreciate you. So please, guys, don't forget to subscribe on the channel, and see you guys in subsequent videos.